can all sit now. Karibuni. Karibuni sana in this special event. Today we have our guest speaker is Excellency Togolani Mavura, the Ambassador of United Republic of Tanzania to the Republic of Korea. Karibu sana Muhas. I'd like also to recognize the Vice Chancellor of Muhas, Professor Apollonari Kamuhabwa. I also like to recognize Deputy Vice Chancellor Academic, Professor Emmanuel Balandia, also the Deputy Vice Chancellor Research and Consultants, Professor Bruno Sunguya, also the hosts of the event, the head of Internationalization and Convocation Unit, Dr. Maria Mamour, the deans and my apology, I forgot. I've seen the president of Muhas Convocation, Ms. Masha Makata Yambi, karibu sana. The deans and director, heads of departments, heads of unit, Muhas staff, alumni, students, there's Muhaso leadership. Welcome very much once again to this very special event where we'll have an opportunity to hear from our guest, Ambassador Togolani, who is going to speak on opportunity and collaboration in health, research, and training between Tanzania and Korean institution. Karibu sana. I would like a round of applause for him. He has come so far kwa kweli. Tunaomba tumuonyeshe upendo kwa makofi kwake. Asante sana kwa kuja Muhas. It is a pleasure to see you here. So without wasting much time, I'd like to welcome the Vice Chancellor, Professor Apollonari Kamuhabwa, to come and give a welcoming remark and also introduce Ambassador Togolani to come and give a talk. Karibu sana, Professor.
Thank you very much, MC. Let me also join my colleagues to welcome Ambassador Togolani to Muhas. He had a courtesy call in my office, and he told me it was the first time to visit Muhas. So we are very happy that you have come the day that we needed you most. So welcome to Muhas. Also, let me recognize the Deputy Vice Chancellors, my colleagues, the President of Muhas Convocation, Masha, Dean Directors, staff, student leadership, and other students. So we are very excited and honored to have Ambassador Togolani Mavura to visit Muhas. And this is the initiative of our unit of internationalization in the convocation unit under the leadership of Dr. Maria Mamour. So we really recommend Dr. Mariam for this initiative. Naomba tumpigie makofi Mariam. And I think that's what is internationalization is all about. So we are honored to have you, Ambassador. Let me say briefly that this institution, what we call Muhas, started way back in 1963. Last year, we celebrated the 60 years anniversary of Muhas. And at that time, it started with 10 students. It was a program of 10 students. And these were clinical officers. These were 90-degree students. And the reason of establishing that institution at that time, because we had independence in 1961. So it was 2 years after the independence of Tanganyika. And the government at that time, they found it was necessary to have trained personnel in the healthcare system because most of the healthcare workers were expatriates. So after independence, they left back to the UK, we started with the one academic program. Currently, we have one. And among these 84 postgraduate programs, we have 20 academic programs, what we call the super specialized program. So we will hear, when we start the discussion with Ambassador Mavura, some of the areas that we need partnership with the developed countries like Korea. This is another area that we need. So currently at Muhas, we have 7 schools. We have 3 schools in the College of Medicine, that is clinical medicine, diagnostic, and biomedical sciences. Then we have the School of Pharmacy, School of Dentistry, School of Nursing, School of Public Health and Social Sciences. But also, we have the Institute of Traditional Medicine and Institute of Allied Sciences. So all academic programs are coordinated through these units. Obviously, we have other administrative units that support these programs. So, Your Excellency, our vision at Muhas, apart from training, also our core function is also research. Currently, we have 163 sponsored research projects. 163. So these are sponsored projects, meaning that Muhas is collaborating with the international or national organization and institutes. So this is we take pride of this because this kind of recognition, kind of collaboration do increase the visibility of Muhas. In the year 2023, that was last year in June, there is an international network called Times Higher Education. They did academic ranking of institutions in sub-Saharan Africa, of universities, and Muhas ranked number 3. The first and second were from South Africa. And I think there were 128 universities that were considered in the competition. And I think the main area where we scored high, it was through our visibility in collaboration, which is translated in this 163 sponsored project. So you being here, Ambassador Mavura, we believe this will strengthen further our visibility. We are going to discuss how we can partner with our partners in South Korea, be hospitals, be universities, research institutions, and the other organizations. Another area that I think we are doing better, we have started doing better, is the area of innovation, taking advantage of technology. We have the unit of innovation. We have a department that is interested in artificial intelligence. So these are areas we think if we get the right collaborators on innovation, technological transfer, artificial intelligence, I think that's the area where we can strengthen our training and research program. Our students are doing very well in innovation. We have established an innovation hub, and we have registered some of the innovation. The majority of these are our students. So I think that's the area where we think we can partner with our counterpart from South Korea. The area I think which we have not done well is the industrial linkage. We have a number of programs that should be touched to industries, industrial farmers, and other areas, traditional medicine, and other programs. And we think, based on the fact that South Korea has very developed industrial sector, we think that's the area where we can have partners to support training, research, and industrial linkage. So the areas that we think we can collaborate, including those ones that I have mentioned, but others could involve curriculum development and review, staff and student exchange, fellowship, and other areas that we think we can collaborate. So, Honorable Ambassador, my task was to welcome you here in this meeting today, and we are eager to hear from you. People are waiting to hear what we can discuss in the areas where we think we collaborate. We have a number of Muhas alumni. They're here. So these are our former students who graduated here. Some are my classmates. So thank you very much, alumni, for joining us today, coming back to Muhas. The president of Muhas Convocation, Masha, she's our alumni. So we take pride of people who have been here and they want to bring back. So when we told them that Ambassador Mavura will be visiting our institution, they said we have to be here. So some will be joining online, some are here physically, and we all want to say thank you very much. Asante sana. Sasa nafikiri ratiba ni niruhusu nimkaribishe, si ndio? Let me now take this opportunity ni mwalike Ambassador Mavura uongee na sisi, for those who are here physically na those who are online. Then we'll be guided by the timetable. I think later on there will be question and answers. Karibu sana, Ambassador.
Jamhuri ya Muungano wa Tanzania. Professor Apolinari Kamuhabwa, Vice Chancellor, Professor Emmanuel Balandia, Deputy Vice Chancellor Academics, Professor Bruno Sunguye, Deputy Vice Chancellor Research, Ms. Masha Makata Yambi, President of Convocation, Dr. Maria Mamur, Head of Internationalization and Convocation, alumni and students, member of the faculties, ladies and gentlemen, na wale kama sisi tusiokuwa na sayansi, salamu alaikum. I should start by appreciation. It's my first time, actually, to be here at the Muhas. I had never had a reason to be here. I did not do well in sciences. We are among those who ran away from your difficult subjects. I studied arts, social sciences, so I never ever expected to be here I only visited the hospital many times, but never thought I'll be part of this gathering today. But thanks so much, Dr. Mariam Moore, for inviting me, for seeing the potential opportunity that I can come here and talk to you. It's not common for ambassadors to come to Muhimbili, certainly, university, but I think it's about time. Last week, I was attending the Kappa Legacy, third Kappa Legacy, and then President Samia Suluhu Hassan, Her Excellency, gave us a very clear instructions that we ambassadors must work on the health diplomacy, finding international cooperation, making our diplomacy answers to our health needs. And here I am. I commend this university for the interest and commitment toward internationalization. I have always been a firm believer of internationalization of universities. We can't be reproducing same ideas and same problems because we meet with the same people. So we need to do internationalization. This is the best way to go globally nowadays. They call it GLOCO. We become global and local at the same time. And, and because of that, your university is actually putting us on the map of international global university rankings. And we are proud of you very much. We don't do the same in the social sciences, so we're proud of you. At least among the global ranking, Muhimbili University has put us on the map. So I think I should start first by saying a bit about Korea, South Korea, because that will make us understand what is possible in terms of international collaboration between our health sector, between this university and Korea. Korea was once a poor country, was once aid recipient country. Korea today is a developed country and a donor country. It transitioned from poverty to prosperity in 50 years. And that means also transformation in terms of health of their people. It's the fourth largest economy in Asia and 12th in the world. It is fifth largest exporter and eighth largest importer in the world. It has a population of only 51 million people, 51.6 million people. Life expectancy is around 82 to 86 years. somewhere there. And the size of Korea is very small. It's actually, you need 9 times size of Korea to make one Tanzania. So it's a very small land. And the significance of that smallness of the land, 2/3 of that land is actually mountainous. So the size of Korea is actually the size of Tabora and Geita combined. That's you get the whole country. And 2/3 is mountains. So all people living in 1/3. That also, for you people coming from the health sector, that means urbanization, 81%. So urban health comes in. How do you deal with that society of that kind of people? But these people are living 82 years on average. So there's a question of geriatrics. How do you deal with the elders? Those kind of diseases. That means also they live longer. So what are those secrets in health that makes them live longer? Of course, the Korean health sector is one of best in the world. It's doing very well. Korea is a capitalist country in terms of economy, but when it comes to health sector, Korea is very socialist, ensuring that everybody, everywhere, get access to health services which are quality and affordable. So Korea has achieved universal health care in the world. It has around 76,700 hospitals, hospitali 76,700 na pharmacy 24,000 ndani ya Korea. Ukitafuta mgawanyo between healthcare, health facilities and people, it is one facility per 500 people. That's where they have achieved. Among these hospitals, 45 are tertiary general hospital, 331 are general hospital, 3,800 are hospitals, just ordinary hospitals, and 72,505 are clinics. So many Koreans go to the clinics. Additionally, they have around 18,900 dental clinics and 15,000 Korean medicine hospital, traditional medicine hospital, which is part and parcel of the health system. Sisi tuna waganga kienyeji au sio? Wao wana tiba za asili. Tiba za asili zinaenda sambamba na tiba rasmi. In 2022, Korea healthcare service market reached $146 billion, which is ranking 11th in the world. The market, $146 billion. It is actually, I think number one is US, $4.5 trillion, then China, 1.2, then you have Italy, Australia, somewhere in between, and Brazil on 193, 178, Korea is 146. In terms of human resource for health, so Korea they have around 95,000 specialists, which is equivalent to 1 specialist per 500 people. Hapo vipi? Among the 76,000 hospitals I've mentioned, 73% or equivalent to 56,000 have more than 1 specialist on their staff list. Kwa asilimia 73 ya hospitali zao zina walau specialist wawili na kuendelea. Korea healthcare system combines public and private providers through National Health Information Infrastructure, NHII, which is a digital platform that supports data sharing across private and public health systems. And around 70% of Koreans are undergoing regular health checkup every year. 70% of them, they just go for regular health checkup every year. In 2022, per capita healthcare expenditure of South Korea was around 9.7% of the GDP. Yeah. That's healthcare expenditure, 9.7% of the GDP ya ile nchi, enda kwenye afya tu. And factors such as aging population, because of that age I told you, universal health insurance, and growing awareness and demand for better healthcare are fueling healthcare spending in Korea. The government finances majority of healthcare expenditure, around 65%, through the national health insurance system. And Korea has a relatively high number of hospital beds. In 2021, it had 12 beds per 1,000 population, second only to Japan. Vitanda vya kutosha kwa wagonjwa. Of course, Korea have their share of diseases as well, and the biggest burden for them is cancer and heart diseases. They constitute 70% of all death in South Korea, with their prevalence likely to rise with the aging. So to tackle diseases, the Korean government has introduced several initiatives such as National Cancer Control Plan, which involves personalized cancer therapy based on individual genomics profile and AI applications for cancer diagnosis and treatment. Universal health insurance that ensures affordable and accessible healthcare for all citizens, with a single-payer system, mandatory participation, and prepaid financing. The Healthy Heart 2030 project aims to produce heart disease-related premature death by 20% by 2030, emphasizing healthy lifestyles and optimize cardiovascular condition management. But when it comes to health, South Koreans predominantly favor private sector. 70% of outpatients are attending private sector facilities. And actually the line between the private and public is almost non-existent. The focus is on treating humans. Doesn't matter who is treating them, private or public. The focus is treating humans. The government or public hospitals focus more on 28% of the outpatients, primarily serving low-income individuals and senior citizens. Top private hospitals in Korea are actually private hospitals, not even government. So you have a Samsung Medical Center, Asan Medical Center, owned by Hyundai, Seoul National University, St. Mary's Catholic University, Korea University, Yonsei University, all these are private. Challenges. Yes, Korea has their own challenges as well. So they face some challenges in the health sector, including low fertility. Up of it, you can export something, right? Health fertility, low fertility rate is one of the biggest problems. Rapidly aging population and ever-increasing demand for social services. So to tackle the challenges, Korea is taking some huge steps in tackling them as health promotion, growing healthcare industry, modernization of traditional Korean medicine, and infectious disease control. But of course, there are some fields which are now suffering for human resource for health as well. When it comes to things like pediatrics, because of the low population growth, which is 0.7% in Korea, the lowest in the world now. You have some clinics which used to cater for children are closing down, same as daycare center. And now they're seeing a problem where medical students don't want to study anymore pediatrics because you are likely not to get people to cure. So now they are shifting to cosmetic industries, to pet industry, because there's average of 1 pet for every 5 people. We have 10 million pets in Korea out of 50 million population. So inalipa sana kuwa daktari wa mbwa, wa nyau. It pays very well. I've attended one. It's a very good hospital. It pays very well. So people go there, people go for cosmetics, and wanaanza kuona wanapoteza watu kwenye kusomea baadhi ya field, hasa udaktari wa watoto is now becoming a challenge. Actually, currently, una mgomo wa madaktari una miezi kama miwili hivi. Sababu serikali imetaka kuongeza kota ya wanafunzi wa udaktari ili kupata watu wakasomea udaktari wa watoto. Lakini the industry madaktari na maprofesa wanapinga ongezeko la madaktari, wanasema itaua market yao. So bado wanavutana for the past 2 months. Lakini vile vile, I think another challenge they have a very strong medical and industrial associations. Kule kinachotokea sasa hivi ndio kama hivyo nilivyowaambia kwamba madaktari walioko, chama cha madaktari kina nguvu sana na chama cha wamiliki hospitali kina nguvu sana. So serikali has a very limited powers when it comes to alter profession. Sometimes ina uzuri na ina changamoto zake, kwa sababu certain kama sasa hospitali zilizoko nje ya Seoul, zilizoko mikoani zinapungukiwa wataalam, na wataalam wengi wanataka kufanya kazi mjini, hawataki kwenda kufanya kazi nje ya Seoul. Serikali ikitaka kuextend wanasema nyinyi ongezeni maslahi, msiongeze idadi ya madaktari. Ongezeni madaktari maslahi mtuone kama hatutakuja huko. So those are also challenges that they have. But I want to touch a bit on traditional Korean medicine, which I think is also very important. So the Korea health system consists of both Western and traditional Korean medical practices. To become a doctor in traditional Korean medicine, one needs to first graduate from medical school, like here, with a degree in traditional Korean medicine, then pass a national license exam. Finally, once the student passes the exam, he or she will receive a certificate from the Minister of Health and Welfare, which allows the individual to practice traditional Korean medicine and provide medical advice in the public health area. Likewise, there is a Korean medicine pharmacist license system. So tu dawa za maelezo tu kwamba vumbi hili ukichanganya na maziwa kutwa mara 3 lita 5 So there is also a pharmacist license system for Korean medicine that permits the manufacturing, prescription, appraisal, dispensation, storage, import, and sale of traditional Korean medicine. In terms of research, they have a National Institute of Health, NIH, managed health research and funding. It's a very big fund. It has around, it gets $5.2 billion per year for research in health, $5.2 billion per year. And for that, $2 billion, equivalent to 32%, goes to academic research and university funding for health. And out of that portion, 67 million USD, sihaba ndogo, which is 1%, goes for international cooperation. So when you talk about opportunity for collaboration, this is where the money is. You have a 67 million US dollars from NIH, which is 1% for international cooperation on demand basis. But again, the funding that goes to universities, which is a 32%, can also be an opportunity for collaboration via the universities' concerns. And this NIH already has a cooperation with some African countries. In Africa, it has a cooperation with South Africa, Morocco, Egypt, Uganda, and Tanzania, COSTECH. So COSTECH has a collaboration with this one. How do we extend it also to Muhimbili? This is something that's why we're here today. And this money covers research exchanges, ODA, Overseas Development Assistance, joint research, and cooperation center support program. Professor Emmanuel was telling me about Center for Excellence. This is something that we can do with such kind of funding. But Korea has become, after becoming a developed country, now has a lot of international engagement in terms of international cooperation on health. It's an area that they have a lot of passion, but it's an area that they think they have a lot to share as well. They participate in WHO very much, and they served the board from 2020 to 2023. There was an executive board, but they're also active in many other initiatives, and they're supporting Africa CDC. So there's some money also goes to Africa CDC for research and development in our part. But also Korea is hosting IVI, International Vaccine Institute. And I know I received like a 2 batch of Tanzania coming for training on the biomedics and vaccine production. In terms of ODA, Korea is becoming important ODA funding in the world in terms of health, one of the largest. And they have programs like Dr. Lee Jong-wook Fellowship, which is under COFI, and I think many have attended from university, in Mloganzila Hospital as well. And the areas that have a lot of interest is maternal, neonatal, child care, child health care, infectious disease control, and primary health care system enhancement. Now, Korea supports Tanzania health sector. We already have some sort of cooperation. But, big but, our cooperation has been much on the health infrastructure. So the cooperation in terms of training that emanates out of it is because of the infrastructure. So they help us build the Mloganzila Hospital, the one we know, the famous one. Now we are on the way to do a major rehabilitation and uplifting of Muhimbili Hospital. That's on the pipeline. And they're going also to build another hospital like Mloganzila 600-bed hospital in Zanzibar called Binguni Hospital, which the contract was signed just last month when Her Excellency President Samia Suluhu Hassan was in Korea. So you see much of here, and then in Dar es Salaam kuna Chanika, mama na mtoto, then tuliona kule Mbagala pia rangi tatu, kuna kituo cha Koika. So there's a lot of this, but so far it has been on the infrastructure. My passion, my role, my aim, and now our strategy is how can we translate this collaboration not only on the physical things, on the infrastructure, but now we go to the software in terms of collaboration and research, and also training, innovation, center for excellences, and industry as well. So in Tanzania, we have two institutions, KOICA, which is a Korea International Cooperation Agency, under Ministry of Foreign Affairs in Korea. And then you have a Korea Foundation for International Health, KOFI, which is under Ministry of Health. So far, they're doing a good job in Tanzania. KOICA has been one of the contributors in Tanzania Health Basket Fund in 3 years. First phase was 2018, 2019. They contributed $6 million US. The second one was 2019, 2021. They contributed $6 million. And the third phase is 2023, 2025. They contributed $8 million US. 80% of the KOICA funding goes to the primary healthcare facilities. But also they are trying to do digitalization of 180 health facilities in the Dodoma region. But again, also they established a zonal blood bank in Dodoma in collaboration with UNICEF. Other projects they're doing in Tanzania, apart from Muhimbili, Chanika, they have also NTDs in Mwanza, Global Poverty Eradication Contribution, Mwanza Neglected Tropical Disease. And then they have a trachoma, watu wa macho, prevention treatment in Lindi and Mtwara. Those are the ones which are currently, but to me, still in a very small way. Looking at the potential, there's so much we can do if we can have a more structured collaboration on the health sector. Now, opportunities and areas of collaboration. There are so many and they are so vast. It is only dependent on our ability to chew, to bite. Okay? Kwanza, I should start by saying the timing is on our side. Kwa sababu Tanzania is one of the 7 they call strategic ODA countries in Africa for Korea. So in Africa, they have identified 7 countries that they are priority countries. These seven countries receives around 70% of ODA given by Korea in Africa. So Tanzania is one of them. So we are already in the good books, so to say. That's number 1. Number 2, during the Korea African Summit, which our President, Excellency Samia Suluhu Hassan represented very well, we agreed that health is one of the areas of cooperation between Korea and Africa. So among the 7 areas we identify for collaboration, health is one of them. So it means there's cooperation on health is one of the priority of Korea-Africa relations going forward. In the same summit, Korea committed to double the ODA to Africa from $5 billion US to $10 billion US. That means Korean institutions, universities, research institutions have more money now to spend on Africa than any other time before. But in university, because of these bars of Korea, Africa, Korea should now engage Africa, there's a growing interest of Korea academia to internationalize and Africanize their institutions. Because they have a lot of universities and they are growing, they're doing so well so far, but for them again to climb into the ranking like ours, like Muhas, they have to do a lot of international collaboration. Student exchange, faculty exchange, research collaboration. And now that interest is to come to Africa as well. But of course, it is good for their pharmaceutical industry. It is good for their diagnostic industry because problems, we own a lot of health problems now in the world. And they have a solution and funding. So there's a lot of interest to come to Africa right now. But in terms of scholarships, Korea has a government scholarship called KGSP, Korea Government Scholarship Program, KGSP. which offers opportunity for students and academia in Africa to do postgraduate, masters, of course, undergraduate, masters, and PhD. But in the medicine field, they don't do undergraduate. In other fields, bioengineering and other related fields, so you can get from undergraduate, postgraduate, up to PhD. So they're offering this, and each year, they are issuing this information. I try to share them online, apart from writing to university, but the response from Tanzania has not been so high. So I'm here to say that it's open for you. Please make use of it. And actually, I don't know whether there's anybody who has gone to university in Korea through scholarship. Any in the room? Oh. He will be a one to testify. It's quite a very generous a scholarship, like anyone or more than many of the Western countries. And Korea is a very good place to live. Because I understand we were so much used to the West and everybody thinking of going to UK, to US, to whatever. It's just, but that side of the world is actually the new frontier for developing in the world. That's the new money and the other one is the old money. So there's a lot you can learn there. It's very international nowadays. And yeah. But again, apart from this government scholarship, universities have a lot of scholarships. There's a lot of scholarships with universities sitting in the president's office. They are there for us to request. So today I had a very good discussion with Professor Kamhabwa and the team, and we have agreed on a number of interventions to make and proposals that they give me to go with that. So there's a lot of these university scholarships, and I believe if we are going to structure some relationships, some MOUs with these universities, then we'll be open to so many scholarships in this field. But Korea also has a very strong pharmaceutical industry. I remember once I was invited by one province in Korea that is focusing on the pharmaceutical industry. It's a cluster for pharmaceutical industry. And their request, it was Tanzania. I was invited myself and the ambassador from Australia. That's when I realized, of course, they had an interest to come here on pharmaceutical industry, but on the side of Australia, I realized that many of their clinical trials are taking place in Australia. And I asked why. And the answer is due to population limitation in terms of size and the genetics, because Koreans are almost one and the same. It's like a same nation, kabila moja, almost wote. So they need to do a lot of these trials outside to find the countries to do that. And I was requesting the VC, like, are we ready to accept one? So I think that could be another opportunity to work with the industry in Korea. I understand before I came here, just like a month ago, there's one I linked with Muhimbili Hospital. They wanted to do something on diagnostics as well. So there's a lot of room for that, clinical trials, which I think, of course, they comes with the equipment, donation, but again, with a lot of training for our people. And apart from this very, very formal, the medical industry association societies in Korea are very strong. If you go to Hematology Society, Genomic Society, these are very big societies. They have a lot of funding as well. Even themselves, they're also looking for opportunity outside to collaborate with like-minded. So instead of, yes, university approach is one way, but I think we can also find an approach between institution. Like I know we have a sickle cell here and probably a hematological association on the other side. That could also be another avenue where we can tap a lot of opportunities in terms of funding. Korea NGOs as well are coming up very well, and they're trying to do a lot of internationalization now. They have a lot of funding as well. That's another area. The foundations we can think of, especially in terms of research. Applied research can be another area. There's a trainings by IVI, as I told, International Vaccine Institute is in Korea. They offer a lot of scholarship for underdeveloped countries. The challenge I've seen is they give you accommodation, local transport. They want you to pay for air transport. And I've seen a lot of Tanzanians applies, but the question is like, Ambassador, could you also help us on the air ticket? So this, I think, is another area that we need to look at and see how we can get the funding. At least if they're giving all that, I think we should be able to raise at least an air ticket for many of us to go there and get knowledge in this area. And then another very important area that I think we should explore, Korea has something called Knowledge Sharing Program, KSPs. They have a number of experts. Of course, they're oversupply of experts, and they also have retirees. People retire at around 60 and 65, but they live up to 90. So they have a lot of energy, they have a lot of expertise, and then there's a way, if you want a capacity building, the government can fund through Koika Fund. They can come to your country or to your institution. You host them for a year or two to build capacity locally in your institution. And to me, I think this is also another very good opportunity that we should use, especially in those areas that we fall short of expertise. I learned things like on therapy, medicine, audio, audiology, and things of that sort. So these kind of areas are cosmetic surgeries, areas that we think we don't know, we don't have much of expertise. We can have these there experts coming to Muhas, staying for 1-2 years, building the local capacity. We learn from them. And sometimes may be much more cost effective than sending many outside, which may be very costly. And the last one is the health startup and innovation industry. I have to declare interest. I'm a board member of Tanzania Startup Association, so I have a keen interest in this area. And I met a number of young people here in the startup ecosystem. Last week, I met Afya Lead with the Mkanda Salama. So we have many of these kind of innovations, and in Korea does that a lot. There's a lot of funding for this cooperation. We can also think of joining with innovation hubs in Korea in terms of exchange, but also collaboration in this aspect. These 10 areas I've mentioned, these are the areas that I see there's a huge potential for collaboration. Of course, it will take some time to structure this, but at least we enjoy very good relations, as I said, and the timing is very right because it is actually, we are meeting at the time when they are thinking also to come in Africa in a big way. So it all depends. Which country will be more receptive to them, they'll get into there. In my conclusion, and then I think we have more time for Q&A where we can elaborate anything that you need to understand more. It's not too late to look to the East. One of the challenges I think we have as Tanzanians, for obvious reason, for a longer time, we have cooperated with the West. It's not bad, but probably in a way, we believe that everything good is coming from the West. But I'm here to tell you, I've been there, I've seen. There's so much good, there's so much opportunity. There's a different world, very advanced world in the East. And it's not too late to look at Korea. Thank you.
Another round of applause for His Excellency, the Ambassador Mavura. Kwa kweli tunashukuru sana. Thank you so much for that wonderful talk and very enlightening. Now, before we go to the session of Q&A, we have a fireside chat, which will be moderated by Ms. Dr. Maria Mamur. I would like to, once again to ask His Excellency the Ambassador to come and sit on the front. We'll have just a few discussion, and then we'll go to the Q&A. And then also I would like to ask Dr. Mariam to come, and she will be the moderator of this session. Karibu sana, karibu. Yes, thank you.
Thank you so much, Your Excellency, for enlightening us on various opportunities that we can tap into in South Korea. And you've mentioned several areas of collaboration, actually 10 areas, so it's just up to us to see where we see fit and grab those opportunities. Sindio? Hi. So I have a few questions, maybe just two, 3 questions, and then we can open up to the audience if they have any questions with regard to what we discussed today. When you started your talk, you mentioned that the President, Her Excellency Samia Suluhu Hassan, emphasized on global health diplomacy. We've learned a lot during the COVID-19 pandemic, that we're living in a global village, and where the world is going now, health is no longer periphery to diplomacy. So please enlighten us on what should be the role of Muhas as players in global health diplomacy.
Thank you, Dr. Mariam, for, for highlighting that one. For one, I'm the firm believer of that, that health is now central to diplomacy. I think COVID taught us a lot, that no country is self-sufficient or self-immune to what transpires. And taking care of even the health of the developing country, it's good for developed country as well. Same with the Ebola, Marburg, and all these kind of diseases. So yes, what should Muhas do? I think Muhas is the leading institution when it comes to health in Tanzania, especially health research and training. And to me, the role of leadership is to shape. That's number one, is to shape the direction and the future of this industry. You are the one who have a lot of data, you do a lot of research in this institution. You should be the one to help the policy. We are the side of the policy side. You should be able to engage us, to help us to engage the world. I think one of the challenge that I've seen being in the corridors of diplomacy for a longer time is you, the scientist people, you are so good in talking to yourselves and talking to data and talking to your journals. You don't talk to us. I think those who succeed in this area is when the academia, I mean the medical field and the policy field talk together. So engagement like this, inviting us to these premises is something very important. We get to learn to know what's happening. Our job, I mean my job outside there as ambassador, is to look for opportunities for Tanzania, individuals, I mean people and the sectors. I will certainly think about the sectors that are looking for me, or which at least I have a knowledge about. So it's very difficult for somebody to just sit and say like, okay, what can we do on health? Of course, we'll look at the hospital, we'll not look at the university. So you need to increase engagement, and this is the role of your office, actually, internationalization. Internationalization should not only about dealing with other institutions outside for research, collaboration, and exchange and scholarship, but again, engaging the policy side, including the Ministry of Foreign Affairs, because I think you talk more with the Ministry of Education, that's your parent ministry, probably talk with the Ministry of Health. Talk to the Ministry of Foreign Affairs. Tell us your needs. We are the bridge. This is our job. I mean, we will have to get to do this task, but we need to be equipped enough to go there to be able to look for this opportunity. So, like in my case, it's only luckily that I'm so passionate about health, so at least I know ABCDs about health sector. But most of the times, as ambassadors, you're just ambushed. You go to a place and people start talking about these concepts, and they expect that you know. And we have never, tulikimbia madarasa ya sayansi. Let's find a way to reunite between the people of policy and the people of science. Yes, this is the best way to go. So you, being a leading institution in this country, you have a unique opportunity and you have a unique responsibility on your shoulder to help us to shape our agenda on global health diplomacy. President has already given us a direction, that's the direction should go. We should find a way to bridge the gap that we have in terms of human resource for health by using international cooperation. Fine, that's his instructions, but how do I go from there? It depends. What should I go and ask? Malaria, What should I go to ask? So you are the ones to help us on what to do. And my discussion today with VC and the DVCs has opened me up a lot on, and now it's like, oh, there's so many possibilities. Oh, this is possible, this is possible, this is possible. Because I'm there, I see opportunity. I mean, of course, I meet these people, some of them coming from the industry, pharmaceutical, they want to come to Tanzania. Sometimes you are invited to this university to give talks, or they just give you 1 or 2, 3 scholarships. But the information I got today helps me to have a comprehensive picture and a comprehensive approach on how to do things. So think about having a session with us, even if via Zoom or whenever some of us are getting here. We can have some sort of a lab between your universities and ambassadors to have some sort of a strategy of how to go forward. That's what I can say. That's the role of your university.
Okay. Thank you so much. Mheshimiwa Balozi, hilo tunalichukua na tutalifanyia kazi. Asante kwa ushauri. All right, my next question. So you've told us the doctor-patient ratio ya Korea ni 1 to 500, si ndio? So based on your experience in Korea, umeona the healthcare sector, what are your main key takeaways in health? So as Tanzanians or as health institutions, what can we do to improve our situation here in Tanzania?
I mean, first thing I'll say that what I'm seeing, looking at Korea and what we're doing here, I see possibility. Their story informs us that, yes, we can attain these things. It's very, very possible. And we sometimes we look so small about ourselves, but I want to say, like, we are doing so good so far. For instance, they institute UHC, Universal Healthcare, around 1975, I think, something like that. It took 12 years to achieve that. Right? So we also here, with the leadership of our president and Minister of Health, we have made the decision to start UHC. Of course, there's a lot of criticisms like, how would you be able, it's only this %. But you have to start somewhere. It's not overnight, but it's something that we can build on. So that's what I've seen, that the best way to go is to go UHC. That's number one. There's no way out. I mean, we may take 10 years, it may take more, but we should start a journey towards UHC. That's one. And number two, private sector. Okay? I think we should focus more on what called True North. A True North is providing a better healthcare in terms of access, quality, and affordability, regardless of who gives it. I don't see much value on the competition between private and public in provision of health services. I think that's another thing I've learned from Korea. Eventually, people will go to anything nearby, so long as the services is one more or less the same. So that's something, bridging, allowing the private sector. And allowing the private sector goes also with another thing that I think we need to take a cue. We talk about PPP so much, but whenever I hear PPP, the thinking I'm getting is we are thinking of bringing a private sector to make profit in health sector. But in Korea, PPP in health is not about making profits, about how do you support provision of services. So it means also sometimes government subsidizing private sector so that certain services could be made. So if you ask the people in the industry of health in Korea, they'll tell you it's not a profitable industry. The government has regulated the sector in such a way the profit is somehow kept somewhere around 15% to 20%. It's more of a service than a profit. Okay? So the government is always making sure that the private healthcare investors will be able to recoup their services and sustain their operations. It's not about being rich. So I think we need to rethink PPP in health sector. It's not about, I take less pride, personally, that a hospital is recording profit and probably sending Gawio end of the year. Yeah, it's about how many people, how many lives you have saved, how improved services, how expansion of services. Those are the kind of things that our people, wenzetu wanaangalia when they're looking at the PPP in health. I think that's another takeaway. The third one is on the research now, research and development, especially data. I came to understand the importance of data in terms of efficiency, but in terms of responding in an effective manner. So it is common that you all say that the budget is not enough, but with data, the budget can be very much enough. Maybe there's a lot of waste along the way because we don't have much data, so our intervention most of the time are very much of the guesswork. So I think the importance of data works very well. Of course, in terms of technology, many would expect technology in Korea, but in Korea, technology, yes, it's there, much more on the diagnostic side, rather than on the hospital side in terms of, health system is working very well, but the telemedicine, for instance, is not taking off because the doctors in the industry are not very much interested in it. And still people still wants to go to the hospital, to the clinics, as I show you the number of the clinics around. So those are my takeaway. And in that also education. The more you increase the level of education, the more you make gains in health. Because in terms of well-being of the people are much more aware of what they eat, lifestyle, when to go to the hospital. It's also help a lot, the power of when, in terms of prevention, of when it comes to also infectious disease control, like in COVID, it was so easy to educate people who are already educated in terms of what to do, what not to do, and that's why Korea is one of the success when it comes to COVID management in Korea. So we are on the right track. We are doing the very right thing. Constructions of health facilities, trying going to digitalization. We need to just fix small things here and there, but our health sector is doing much better because I had the opportunity before when I was working as assistant to President Kikwete. He was chair of the panel that interrogated what happened in Ebola in West Africa. So it was a UN panel. So we got to receive reports from the many other countries, especially Western Africa. And you'll be surprised, I mean, in this country, despite all the challenges, we have a health system. We have a health system and it is functioning. There's no this referral system at all. The doctor-patient ratio is even in bad shape. And so many, even guidelines are not there. I mean, public institutions are very thin. It's private, it is just sporadic. So we are doing so much actually, so much good in this country. And when you're talking to Koreans, they tell you 30, 40 years ago, they were in the same situation. So we are in the right track. We need to just keep on moving, have faith in what we are doing, and not look at ourselves too small. Thank you.
All right, so last question before we open it to the audience. So now we've signed the MOUs, right? We'll have maybe faculty exchange, student exchange. So what are the do's and don'ts in terms of our people coming to Korea, or when you expect Korean coming to our institutions, based on your experience?
Okay. Of course, success in any cooperation depends much on the understanding of culture. We need to understand each other. It is common of human beings to hold with a lot of suspicions something that we don't know. Sometimes we either hate or we fear, or we over-love something because we just don't know much about it. And for us to successfully engage with Koreans, we need to understand Koreans. As I said before, we are not so much used to the eastern side of the world. So tendency is to look at Koreans in the eyes of other Asian countries. And my first thing I would say, Koreans are simply Koreans. Koreans are not X, Koreans are not Y. Okay? They are simply Koreans. And they appreciate to be treated as such, not to be seen in the mirrors of country X or mirror of country Y. They're just Koreans, and they are unique in so many ways. They are not alike any of other countries in the East Asian side that you know. Okay? In terms of culture of work, They have a high respect to hierarchy. They have, their decision is much based on information and data. They take time. They're bureaucratic in a way. They take time because they follow procedures and rules religiously. But also they're very fast when they make decisions. So they may take time in terms of the process, but once they make decision, their culture is called pali pali, fast, fast, pali pali. So, and they work hard, long hours. Among the OECD countries, Koreans work 150 hours more compared to the rest. So they're workaholic. They work so hard, so fast. And otherwise, they're very straight people, and they're people who live to their words and commitment. So once they commit, you are a friend, they agree with you on something, be sure that they will do it to the letter and spirit. So those are the things that you need to understand. Don't confuse them with anybody else. Koreans are simply Koreans. Try to learn them as Koreans. Koreans are very straightforward in so many ways. Koreans make decisions based on data. And they keep records of the conversation. There's no small talks that you can just say words here and get away with it. Ukisema kitu wazako wana record, wanaandika na wanafuatilia. They take every word you say seriously. Sasa yale mambo yetu ya inshallah, nasema tuko pamoja, tuko vizuri. Kimsingi, so baadaye wasema lakini siku hizi hili nilisema tu bypassing. So whatever you say, be careful because they take conversation very seriously, and especially they take conversation during food very seriously. So you have a discussion in the meeting, say like, can we have for lunch? Can we go for dinner? And the conversation you speak, they take it very seriously. But the people, once they open the heart for you, they open it for you. That's how. They're very committed friends. I mean, people you can really, I would say they are reliable. And so they can be a very good partner, and they have a passion to give out. They have a passion to share their success story with the developing world. They've made it, and they think they have obligation also to support other developing countries to make it. Now, if you meet, especially Koreans who are around 50 years old, you will enjoy much the conversation because most of these have lived these kind of challenges that we are talking about. So when you talk to them, they say like, we understand, Your Excellency. Even when I was growing up, this was the situation in my village, this was the situation in my city. I grew up the same thing. So almost in all these kind of stories that we have here, our old frustration, they have lived these frustrations. So they might be a good partner because they really understand. They have that humility to understand what we are going through because something relatable in their very close memory. So I think we have a good partner. I strongly advocate and encourage this university to take that direction, and I'm ready to support that.
Asante sana Mheshimiwa Balozi. So if we have any questions from the floor before we close. Yes. I'll take one hand there.
Thanks. My name is Henry. My name is Henry Geoffrey Morongo from Bachelor of Environmental Health in School of Public Health and Social Sciences. My question is, how does Koreans have invested in environmental health science as the key or backbone in public health? As we can see, their life expectancy from 5 last decades have been increased up to currently, you have said, 2022 to 2026 years of living.
Yes, let's, another question, yes, from the lady there.
Okay, my name is Marietta Mashimba, a health administrator. My question is, how can we collaborate with Korea on health research and health promotion? As His Excellency TOGOLANI MAVURA said that Koreans have invested on welfare of the people to make sure that they know what to do when to go to the hospital. So in my mind, it's come on health promotions and preventive measures, promoting health sector and promotes health to community to understand the importance of visiting facilities or to understand how can they themselves make sure they take care of their health. So it's come on my mind in terms of health promotion, maybe writing proposals or whatever the case. His Excellency can tell us how can we build a strong collaboration in terms of that.
Thank you. There's another question right here.
Thank you very much. My name is Dr. Johanna Liza. I am a public health researcher, and I was so interested with the facts you talked about population composition in South Korea and how that affects their research capabilities. And I was trying to look at their demographics compared to ours. Their pyramid is inverted and ours is quite the opposite. Where I'm working, we deal with a lot of adolescent health research in terms of nutrition, reproductive health, and I've seen that they have very low pediatric, and then what follows adolescents from 10 to 20. And we have the opposite. We have many pediatric individuals, and then what follows is adolescents 10 to 20. Now, we have been doing a lot of research with countries from the US, as you said, Canada, Europe. How can we tap these research opportunities from South Korea? As we have seen, there is that, there are those chances, opportunities that we can link together and, you know, contribute more to science.
All right, there is one last question right there at the back, and then we can, okay.
Okay, my name is Timos from B Form 1, and my question is, you have said that most of Koreans have life expectancy more than 8 years, but according to WHO annual report of 2022-2023, I showed that Tanzanians, we have about 61 years of life expectancy. So what's the secret behind Koreans to have such kind of life expectancies? And what can you advise the people here or even the Tanzanians to have such kind of life expectancy? Thank you.
Thank you so much. Tunamalizia na Madam President.
Thank you very much. Asante sana Ambassador with the very informative talk that you gave us, even the responses that you also gave us. In light of the making global goals local business, and also taking advantage of majority of us alumni, some of us are not in the health sector as such, but rather in the development arena. And when you look into that, we are having few than half of the expected time to reach the 2030 agenda. How do we connect the development that has been done in Korea and allow us to embrace such zeal to make us also close the gap of what we need to reach as far as the Agenda 2030 is concerned? Asante.
Thank you. Kuna swali hapa nimefikishiwa on the same line. So some of us here are not in the health sector. So maybe ukimaliza unaweza pia ukatuambia fursa za biashara, au kwa mtu ambaye angependa kwenda kuhamia na kuishi Korea, how is it like, how do you start, and are there opportunities for kuhamia nchi kwenda kufanya kazi Korea? So please inform us kuhusu fursa za biashara na pia opportunities za kuishi Korea for any of those that might want to do so. Asante. Umeweza kucapture au niku? Okay, asante.
Oh, thank you, Dr. Maria. Wow. Let me try to respond. I think Henry asked about environmental science and the public health and how it works in Korea in terms of improvement of health and lives. I would say my takeaway, because I've also tried to understand much how it works. I might not be touching much on the environmental science per se, but what I've seen in a very layman kind of look, if we improve 3 things in a society, it affects a lot in terms of the health of the people. First, quality of air. If you improve the quality of air, just quality of air, punguza hizo sijui sigara, fumes, moshi magari na kadhalika, quality of air, you change a lot in terms of people's life. Deal with the respiratory health issues, which in Korea and being in the northern hemisphere is one of the biggest challenge. So in Korea, they're very serious when it comes to air pollution. There's strict measures, high taxes in terms of cars. Kila gari, kila mwaka lazima likafanyiwe emission test. So they make sure that the air outside is very good. Like, of course, it's an industrial country, and most of the time they get a lot of dust from the industrial China. So they even have a system of alerting you every day in the morning of the quality of the air of the day. Kwamba leo hewa ni chafu. And you find people go out wearing masks. Huhitaji kuwa na COVID kuvaa mask. Everybody's just wearing masks. Sababu tu wameambiwa kwamba leo kutakuwa kuna a lot of dust on the air. So quality of air, they've done so well. And that has helped a lot into improving people's life. We lose watu wengi sana wanakufa siku hizi kwa respiratory, kwa cancer hizi za mapafu na kadhalika. Sometimes kwa sababu hatujui tunavuta nini. That's one. Number 2, quality of water. You are doctors, and I don't need to, many of you are from medical field, I don't need to say much. Improve many of the problems, particularly of the poor people, is waterborne diseases. Simple. Improve water and sanitation. That changed a lot. So the quality of water also is one of the areas they're working so hard and make sure that all the time, I mean, you can use the tap water, maji ya bomba na maji ya chupa hayana tofauti in terms of quality. And third, quality of food. We are what we eat. It's very difficult to bring food in Korea. It takes up to 8 years kuingiza zao moja in Korea. Unataka kupeleka embe Korea, it will take 8 years to negotiate embe kuingia Korea. There's a lot of phytosanitary measures that you have to. So they make sure that everything, consumers are so much protected. Everything that goes to the market, in terms of food, it's checked. There's a board for everything, to check for everything that is consumed by people. So the quality of food as well is. So for just that, things which are actually coming from the environment, you've already solved a lot of health issues. So you can imagine that in their hospitals, they will get not so much problems, kwamba watu wana diarrhea, watu wana magonjwa haya ambayo kwa kweli yanaweza kutibika. So that's the secret. Here Tanzania, katika vifo magonjwa matatu yanaua sana watoto wachanga ni malaria, diarrhea na pneumonia. So you can just tell. You solve this quality of food, quality of air, and quality of water, that's where you are. And that's something they've done so well. Marietta asked about health research and promotion and what we can learn. When I was growing up, sikuwa kuna kipindi cha mtu ni afya hapa Tanzania. I went to school up to 1992, I was standard 5. Tulikuwa nasoma inaitwa science kim, halafu likapotea likaingizwa kwenye maendeleo ya jamii, sijui vitu gani. Lakini we were taught very basic things about chakula, umuhimu wa chakula katika mwili wa binadamu na umuhimu wa afya, kusafisha vyombo, kuvua viatu. So Korea until today, you don't get into somebody's houses with shoes. You put your shoes, na wala si Waislamu, you just put your shoes outside. Simple, huwezi kuingia na viatu ndani. Okay? And there's follow so many other basic sanitary measures. And what's the secret behind? During the 1960s, si tulipoanzisha vijiji vya ujamaa, early 70s, tulipoanzisha vijiji vya ujamaa, wao walianzisha programu yao inaitwa Saimaul Udong, New Village Movement. Okay? In this New Village Movement, which is purely like vijiji vya ujamaa vya kwetu, it was started by teaching people to read and write, literacy, continuous education, and education about health. Kwa hiyo health promotion ilifanyika huko vijijini. Wao tulikuwa na bibi afya, sio zamani tulikuwa naita bibi maendeleo. They were going and teaching people on how to. So those things have now become part of culture in Korea. Okay, so we need to do things like this here nowadays. Of course, now I see we are moving towards the having a lot of the community health workers, CHW. I think it's a good move. It's a question of now which other role are we giving them, apart from just taking people to the clinic and following up on ABC. But I think we need this agent of change. Health starts with mind, attitude. Okay? So yes, we'll be having so many donor projects and many DFPs, many seminars and workshops on the public health, which is also good. It's a good employment to so many of you. But we must go to community to help the community to shield against diseases. It starts with a changing of attitudes, how we live in everyday life. And that's something they've done so well. So to me, I would say like it's about revamping the system that we have. That's why I said we are so much in the right track in so many things. It's about going back to the basics and use the basics to prevent. It is, even if I don't have data, but just for a simple observation study, some of you who are doing clinical here, the people who we say are middle class, what kind of diseases bring them to the hospital facility compared to the people who are not middle class? Certainly, because you see increasing the level of education, understanding, knowledge and understanding, changes the even type of diseases people will be coming up with. So most of these will be coming with the non-communicable diseases, diabetics, and many other things. So that's a secret, I would say, in that. Liza asked about research opportunities. I go back to the same. Opportunity is there. What we need is how do we structure them? We need some structural relationship between Korean institutions and Tanzania institutions for that research to take place. Research cannot take out in the air. There should be a framework somewhere, because there's so many things involved here. There's also issues of data, there's ethical issues, and so many other things. So we need to have a framework for this, and this is what I think diplomacy can help to facilitate our institutions to be able to have such kind of cooperation. And then after that, it will be up to you with your proposals to write. So that's what we're going to work now, having this kind of framework institution. Timothy asked about the life expectancy. That Korea is 86, ours is 60, and what can we do more? Probably this answer will relate with what I already said. First of all, improving lives, improving environment that people live, changing attitude of people towards life as well. Koreans are very sensitive with their health. I mentioned here in data that 70% of people do annual checkup. If I start doing a survey in this room, when did you do the last health checkup? Just overall, just umeenda hospitali kujiangalia afya yako, wangapi hapa? And you'll be surprised actually, doctors are the ones who are not doing it. Paka usikie unaumwa ndo unaenda hospitali. Lakini most of these diseases, you live longer if you adapt to a certain, with a healthy lifestyle. But again, most of the disease are either prevented or even if they're not cured, at least you start getting a clue much more earlier. If you just have a tendency of doing a health checkup, you just knowing that, okay, maybe I'm unlikely to developing diabetics in a certain years to come because of the insulin resistance that has started building on my body. So naweza kuwa na mwili mwembamba kama kwangu sio mnene, lakini I have a lot of fat. Nimenenepea ndani tu, nje inaonekana niko vizuri. And people say like, you're very healthy. I mean, you don't look fat, but probably unene wangu upo kwenye maini huku na mautumbo. Wengine wana unene sehemu zingine, so anaweza kawa yuko healthy kuliko mimi. Unless we check the tendency of doing health checkups. So this is what they are doing. They've improved sanitation, air, and everything around, which we are doing a lot in this country. We are building hospitals. We are increasing the diagnostics. Number of sites za mikoa na wilaya huko, ma CT scan, ma MRI, manini. We are doing, our laboratories are improving. We are doing so much. And that's why today Tanzania wanaishi miaka 65. It was 35 years during independence. We have doubled from independence. It was 35 years wastani wa kuishi kwa Mtanzania, mwaka 61. Leo ni miaka 65. We have doubled it. So we are doing so well. Koreans are now 80. Lakini hata wao 20 years ago, they were just 60s kama sisi. So as it improves, na kwa kiasi cha kuimprove tu maisha, kadiri watu wanavyokuwa na maisha mazuri ndivyo tunavyoweza kuimprove life. Lakini kubwa sana ni afya inaanza na wewe. Lazima watu wapunguze risk. Maka pia tunaishi maisha yetu yako very risky. Hata kama sio habari ya kula. The way tunavyoendesha huko barabarani. You can imagine. Tunavyoendesha tu barabarani. Tunachokula, tunavyokula, ambavyo hatulali. This basic things. So change of attitude. Kila mtu anakimbizana na kujenga site na anaanza tazikuwa wapi. Wanasema wanachoma tu moto mili. Because I think we have so much stress. We accumulate so much stress in our life. We have so much competition. We are so much in hurry. Tuko tuna mbio sana barabarani kuliko mimi wanasema ile kasi ya barabarani ya Tanzania ingekuwa pia kwenye kazi na mafaili ingekuwa hivyo hivyo. Tungekuwa tungekuwa mbali sana. So to me it's just adapting. Lazima tuanze of course focus of treatment is good. We should continue with it. Lakini I think we should now go much on the prevention health. Prevention health, community health. I think this is the best way to go. To prevent people from falling sick rather than spending much more energy on curing people when they get sick. It's okay to have that, it's very good, but I think we should go to the prevention. If there's a success in Korea, it's also improving much on this side of prevention and community health. So unapunguza burden to the health system. And then curative inabakia kwa wao kama wenzetu hapo naona kwa visukari sasa kwenye cancer ndio wamehangaika, ndio wamebaki zaidi wanahangaika na masuala ya curative. Lakini mambo mengine haya magonjwa ya kutokanayo na maji na chakula na mazingira ambayo si salama na safi wameshafanikiwa kuyakimbia kwa kiasi kubwa. 2030. Wow. I'm trying to find an answer because I don't think it's something very short. But one thing I think I've learned from what they're doing in Korea, and I think we should do here, is mobilization. And Koreans are very good in mobilization. They identify a problem, and then they mobilize. Once they put their act together on something, it is the private sector, it is the CSO, it is the government, they all pull or push on the same direction. Okay? Sasa, when you talk about SDG in Tanzania, you simply talk about government, and you talk about CSOs. Okay. I know it includes, but many private sectors are waking up. I mean, people in private sector, they don't wake up going to their office thinking of implementing SDGs or thinking of anything sustainable. Most of them still limited to profiteering. So I think we need to, it's an issue of mobilization. You have to identify areas that we can make headway, because I think another challenge that we have is, of course, SDGs are very broad. There are 17s and a lot of targets, and we are trying to tick every boxes, which is very good, but from the experience of the MDGs, it did not work. The resources are very thinly spread, and we have to be able to think about prioritizing on certain aspects first. And this is something that in the development path of Koreans, something that's been done very well. They have been very focused on what they do. They usually prioritize according to research. So they can say 2 years on something and do that something to the letter and spirit instead of spreading on everything. But second is mobilization. You mobilize the people, the private sector. Once Koreans have managed to mobilize people to donate gold to pay national debt, Nchi yao iliingia kwenye madeni, wananchi wanajitolea dhahabu, wanapeleka serikalini, serikali izieushe, iuze, ipate hela ya kulipa deni la taifa. Yes. Oh yes. Hapa tukiambiwa tukiambiwa hapa tozo kidogo tuiongezee kwenye kitu kelele. So you can tell kwamba tunasema mobilization zote wamefanikiwa sana when they have a unit of purpose, the unison of purpose when they agree on something. Like now they have an aging population problem. Just last month the president announced that now hili ni janga la kitaifa. We are going to do something, do or die. All private sector zimeitwa, serikali, mashirika, wote wimbo ni huo mmoja kwamba sasa tunakwenda kwenye. Kwa hiyo wenzetu wanakamia jambo linafanyika. Sisi tunajadiliana sana hata pale ambapo tumeshafanya maamuzi. Kwa serikali imesema tunakwenda UHC. Basi sauti zote ni haiwezekani, deductive approach. Tunajua sana kuvunjana moyo. Lazima to change, lazima to change. That's how we can do. Yes, the task ahead can be very monumental. I totally agree. Yes, we might need a lot of resources, but we cannot underestimate the spirit of people. I think if Koreans have something are doing very well, is underestimating that the human energy is the greatest resource. Kama nilivyowaambia, nchi yao haina madini, haina rasilimali, imejaa, kwanza ni ndogo, imejaa milima, lakini kitu ambacho kitu wanaita fighting spirit. Kama kuna resource wanayo is tapping on human spirit. Human beings can do wonders. Kama Watanzania waliweza kujimobilize, wakavamiwa na Idi Amin, wakaenda wakapigana vita. Kwani tulikuwa tuna hela? Watu walitolea ng'ombe wao na ni wao. It's possible. So tuna uwezo wa kutatua matatizo mengi ifika 2030. If we just put our act together. If we don't think that government has the only responsibility of doing it. If we feel that it's a responsibility of each one of us. So to me, that's the way forward, and I think that's very possible. These are the things we need to learn. We need to learn their way of approaching things. That's the only thing. In terms of the immigration in business, I would say Korea is a country with a lot of opportunities. A lot. Na mko yangu mjomba wangu nifike kwanza nikae bwana kuangalia situation. Not so easy. The immigration system is very tough. We have hardly 300 Tanzanians in Korea. Even Kenyans have hardly 300 Kenyans in Korea. I once met my colleague ambassador from Nigeria. They only have around 1,800 Nigerians in Korea. So if you find a country where Nigerians can only be 1,800, you should learn something about it. I once met the ambassador of Lebanon, and he told me like, no, Lebanese here, they're just 56 Lebanese in Korea. But they say we have around 6 million in Brazil. I once met the ambassador of Pakistan. I said like, so we were talking about this, like, how many Pakistanis you have? He said like, 30,000. I was like, wow, congratulations, so many. I said like, no, this is very small. If I sit with my colleague, Pakistanese ambassadors, I cannot even say anything, because in other countries we have millions, but in Korea only 30,000. So why am I saying this? It's a very tech country. Everything is in system and digital. So it is not easy kuzamia na kusurvive. You can run, but you cannot hide. You eventually get into the net and get out. Kwa hiyo the best way ni kutengeneza utaratibu rasmi wa watu kwenda kufanya kazi Korea. This is what we are working. When Her Excellency President Samia was in Korea, among the discussion he had, items he had to discuss with the President of Korea was to Tanzania and Korea to sign something called the Employment Permit System, EPS. That is the formal way of allowing foreigners to work in Korea. And Koreans respect a lot about labor laws. So people work in Korea, the conditions are working are very good. Very good. The industrial labor industry is very much organized. People are very highly paid. Wanasema nini? Mshahara wa kima cha chini ni around $2,000. Around $2,000. And that is somebody who works around 8 hours a day. It's not even kwa ukipiga ile na overtime kibongo kikomaa unafika 3,000 mpaka 4,000. So it really pays. Lakini ni rasmi. Lazima uingie rasmi, upate kazi rasmi, ulipe kodi rasmi. So, but now, because of the population problem that they have, with the aging population, so they are in very dire need of people to come and work. And that's why we're now discussing, and hopefully the opportunity will open in this area. Of course, in the area of medicine, with the aging population, they're now thinking a lot in terms of the nursing care for the elderly. They're thinking, because they don't have them ndani ya nchi, so they're thinking for them going to Korea in the near future. Of course, they are still debating on the question of language, itakuwaje, their culture and ethics, but that's an area that is going to come in the near future. Udaktari, I don't think so. It's going to be difficult to practice for a while. Lakini vile vile, in terms of the IT and startups and innovation, there's a room for that. They have kitu wanaita digital nomads visa. I've already started issuing that. So kama una particular expertise, you are in doing startups, you're doing innovation, there's a lot of programs, incubation programs, to invite you in Korea to stay. And now they've also extended for students who are studying in Korea. When you finish, I think they give you around 2 years visa now to stay, to continue working, looking for a job and working in Korea. So opportunities for work are going to open. But in the meantime, in terms of trade, I would say we are going there. Korea, so far, trade between Korea and African continent, all African countries, is only 1% of Korean trade. Korea trade with Europe, with the US, with China. And one of the reason is because of they are producing very high-end products, very technological products, very high-end products, and therefore there have been limited opportunity for trade between our two countries. But now they are thinking of coming to Africa because of this summit and because of the efforts of the governments that are going on. We are now negotiating economic partnership agreement. They have chosen only 3 countries in Africa: Tanzania, Morocco and Kenya. And this is the importance and value ya safari za viongozi. Mheshimiwa Rais alikuja Korea kwa mazungumzo yale na uzito ule aliouleta. Korea wamechagua Tanzania kati ya moja ya nchi 3 ambazo watajadiliana na kusign economic partnership agreement. Okay. Sasa that will translate into openness, fruits as an investment. Na Korea, usually Korean companies are going where the government is going. Wanasikiza serikali yao kwa kiasi kikubwa sana. So we're expecting more investment, we're expecting more, watatufungulia trade. So far, una bidhaa zako hapa ziko haziwezi kuingia Korea. So they need to open up those markets for us. They need to build capacity. We're negotiating that they build the capacity for us to be able to export. Kwamba una parachichi yako ndio yako hapa. Lakini huwezi kuyaingiza Korea kwa sababu lazima yapite a lot of tests. So we are going now to agree on those kind of standards to allow us to get a preferential market. So the fact that we don't have much of trade opportunity with Korea right now is not a Tanzanian problem. It's an African problem actually. Okay? Lakini Tanzania now, we are closer to that opportunity because of these negotiations that we are about to start, economic partnership agreement. So future of trade between Tanzania and Korea will be very good, very bright. Kazi yangu mimi alionipa Mheshimiwa Rais ni kwenda kufungua mahusiano, kuweka misingi ya mahusiano kwa sababu our embassy in Korea is only how many years old? 6-7 years old. Tumefungua ubalozi mwaka 2018. So we have not been in the ground for so long compared to nchi za wenzetu. Actually, we are the last African embassy to be open there. So we are now trying kuweka misingi ya mashirikiano. And that's why the visit ya Mheshimiwa Rais was very important to lay down that foundation. So we are going forward. There's a lot of opportunity to come in terms of trade. No doubt about it. Korea imports, I would say, is the largest importer. They import everything. The only thing they want to produce in terms of chakula, for instance, ni mpunga tu. They're doing very well in rice. But but almost everything else they import from different parts of the world. So there will be a lot of opportunity. Issue ni kufunguliwa soko. Kifunguliwa soko, kazi kwetu. Tuanze sisi wenyewe na mambo yetu sasa ya kupiga chengo. Ukipigiwa simu, mara mzigo umepotea, mara nini. Ukiuliza vipi, sema nazo yani brother, yani kuna yani parachichi za kumwaga. Kweli unazo, haya lete, trip ya kwanza, trip ya pili, trip ya tatu, unajua vilienda vikarudi. Simu yangu lisahau kwenye chaji. Asante. Thank you so much.
Asante sana Mheshimiwa Balozi. I believe to exhaust maswali, but I know Dr. Rehema had a question. Yeah, library. So you can ask. And is there any other burning question before we close, because we want to close? Okay, nitampa nafasi Betty na daktari hapo, then we close.
Yeah. Thank you very much, Ambassador, for a very well-narrated information regarding Korea. My name is Rehema Chande Malia. I'm the Director of Library Services at Muhas. So I wanted to ask you about the memoirs which you have usually written. Is there any way of archiving those information into a book?
Written where?
On the social media. Thank you.
Asante Dr. Rehema. Dr. Betty. Okay, please. And then tutamalizana na Dr. Betty.
Okay. My name is Dr. Frank Muhamba. Our VC put it clearly that at the university we have the super specialized programs. I am taking plastic and reconstructive surgery. This is a new program, and we are the second intake, and I'll be completing my studies this year. And when it comes to collaboration, I think this is an area where we need so much collaboration, particularly in curriculum review, and if also the collaborators can help us in having skills lab, which is very important for surgical specialties. And I've secured an opportunity to be hosted at Aston Medical Center from March next year for areas in plastic and reconstructive surgery where I thought I have more exposure. And maybe if you will still be there, I pray for you. I may meet you and discuss how we can convince Aston Medical Center help us in terms of training at your university, but also improve in clinical practice, particularly in area of microsurgery and the other areas in plastic and reconstructive surgery.
Yeah, I'm Betty Allen Maganda from the School of Pharmacy, Department of Pharmaceutics and Pharmacy Practice. In our department, we have been preparing some cosmetics product. And in your talks, I heard about cosmetics. So I'm very interested to build a collaboration with some collaborators from Korea who can help us to build the capacity in this area. And even if we can have some people who can help us to teach cosmetology, because in our curriculum, we have a section of cosmetology, especially for our masters, our industrial pharmacy masters. So I would like to have collaborators in this area. We have our product, which we make from our department, and some people, they've used it. And for the time being, we are making it from natural products. We have carrot extract cream, tomato extract, and potato extract cream. So we will need to improve it if we can have some collaborators from Korea. Thank you.
No, thank you so much. Starting with Dr. Malia. Yeah, I think there's so many requests that I turn my random thoughts and quotes into a book. Okay, we will consider that. I mean, there's a lot of requests to do that. When I started, I never thought much of the book. It was just an idea coming, and so like, oh, where can I post this idea? I might use it one day. So maybe they may have luckily in my previous discussion with the VC, we spoke a bit about that area, and Koreans are doing very good in this area on the plastic surgery. And yes, inshallah, if I'll still be in Korea when you come, tuombe Mungu kipeperushi kisitoke. Then I'll be more than happy to welcome you, to talk to you and walk to you. And usually I'm doing that a lot whenever I get opportunity of Tanzania studying in Korea. I usually make effort to meet them and use that opportunity to meet their professors and their institutions. They help me so much. Wanatusaidia sana kujua fursa zilipo. Kwa fursa za Korea zina revolve much around universities. Wenzetu, they have a very good ecosystem where university, industry, and the policy collaborates so much. So university is one of the area where a lot of ideas and projects are emanating. So idea started at the university, goes to the industry, becoming a product, or started at the university, go to the government, becomes a policy. So they have this very strong interaction, and I will certainly welcome the opportunity when you come to visit there. Na wakati mwingine mkija matusaidia sana kwa sababu many Koreans as well are not very much exposed to the world beyond America and Europe and Asia. So sometimes some of them don't even believe that we have this kind of experts. Do you have this expertise in Tanzania? So when mkija mnanipa ushahidi sasa, mnaona mambo yetu tuko vizuri, you know, like become so easy and become they usually na kwa kweli I must say here this mkoa Dodoma General yupo kule. Umeenda kuwatembelea. Nadhani nyingi ni product ya Muhimbili hapa. Tuna watu wazuri sana. Wanafanya vizuri sana wakienda kule. So I use that opportunity when you come. I'll certainly visit with you, and that I take that opportunity pia kuzungumza nao, sababu hapo ndipo unapoenda unapowashukuru ndio unapata fursa ya kuomba tena. So I'll do that. So please, and I always encourage them, jamani, mkifika tutafuteni, tuambieni, tualikeni tuje. Na balozi akienda inaongeza sana uzito. Wanaona kwamba we value their programs. Kwa hiyo usually wanapata hamasa ya kuendelea zaidi na this kind of program. Sababu lazima uonyeshe uhitaji. The more you show demand, the more they give. Kwa hiyo unakuta nchi za Asia zinafaidika sana na Korean support. Kwa sababu of course wana advantage ya culture proximity compared to us, na wametoka nao mbali zaidi. Sisi wengi ni kama wanadonoa kujaribisha. Kwa whenever I hear that opportunity, I usually make effort to reach there to also add voice to show that we value this kind of support they're giving importance. Na kwa kweli wengi ukiwatembelea they start increasing. Next year they're increasing the funding. So I'll do that when you come to Korea. Please let me know. Dr. Betty on pharmaceutical amezungumzia kuhusu cosmetology. Yes, that's another area ambayo Koreans are doing so well. Actually, ndio yosema madaktari wengi sasa ambao wanakimbia watoto na mengineo wana migrate towards cosmetology. Na last 2 months kuna institution inaitwa National Biological Research Institute, NBRI in Korea. I went there, and I think it may be very good collaboration na ninyi in terms of the bioengineering na biomedics. Wao wana mahusiano na TAWIRI, Tanzania Wildlife Research Institute. and they've done a lot of research kwenye masuala ya ndege, birds in the western Tanganyika side, western Tanzania side kwa Lake Tanganyika. Lakini ufika pale kwenye exhibition yao waliofanya, of course wamedonate a lot, wametengeneza specimen nyingi wamedonate kwa ajili ya kufundishia kwenye chuo cha TAWIRI cha wenzetu. Lakini pale nikakutana na product ya nywele ya kuzuia nywele ya prevent hair loss na kuongeza na kuzalisha nywele. Imetokana na mmea mmoja, nimesahau jina kitaalamu. Wameupata Tanzania. Kwa wameupatent wao na TAWIRI. Na hiyo product inaingia sokoni early next year. Yeah. So there's this opportunity to do such kind of things, could develop products. They're very much interested into cosmetology in terms of ending into product. Kwa hiyo kama mna vitu vya namna hiyo mnafanya kama ambavyo mnahitajia hizo kind of products, I think this is an area that you can work with taasisi kama hizo ili kuweza so please reach out to us through DVC research. We can work on that as well. Yes, so that's what I say. Thank you.
Thank you so much, Ambassador. Tunashukuru sana kwa kushare hizo opportunities, kwa kujibu maswali, and tumeelimika sana. So for that we thank you. We thank you for your time. And tuna imani kwamba kutoka hapa tutakuwa kuna kitu tumejifunza na kuna fursa ambazo tutazipata baada ya hapa. So thank you so much for enlightening us. So that marks the end of our fireside chat. Helen, back to you.
Thank you so much. Another round of applause for Ambassador. That was very interesting. Thank you so much. And I like Dr. Rehema's thoughts about your comment. I really like them. I read a lot of them. Nimefurahi leo kuweza kukuona. Before you go down, I would like to welcome the Vice Chancellor to come. I would like you to stand, please, so that we have a small token of appreciation to you, which will be given by the Vice Chancellor. Mariam, can you just take it? And yeah. Yes, I will also welcome the Madam President, please, also should come. That's a token of appreciation for Muhas for coming and give this talk. Tunakushukuru sana. We wish you could, I hope you will put it in your office. Remember, as always. Asante sana. So you can just take your seat, please, and I would like to welcome Madam President to come and give a vote of thanks. In the meantime, we will have some few pictures, photo taken in the front. I would like some people to come and just remove this a bit, setting of this, so we'll have some few pictures after she has finished the vote of thanks. Karibu sana.
Oh. Asante sana. Our honorable guest of honor, Ambassador TOGOLANI MAVURA, who is the High Commissioner of Tanzania to Korea, our Vice Chancellor, Professor Apolinari Kamuhabwa, member from the academic staff, all protocol observed. Good afternoon. It is with the very great honor and pleasure that I stand here kusema asante. And I'm sure we all followed the discussion. earlier on, Ambassador stressed that such talks, when they're taking place over lunch, over dinner, every word counts. Leo hatukuwa na dinner wala lunch, but every word counts. We have had a very privilege of hearing from you. And of course, it has enlightened us on the myriad of opportunities that Korea has to offer. And of course, with your presence on that end. We believe that from the space of academia, space of private sector, space, of course, of political, and any other space, we believe our bridge will be further strengthened. Of course, first of all, your time. We believe you have such busy time, particularly when you are on this other end. But again, you decided to embrace this offer when we extended an invitation. Tunasema asante sana. And of course, asante Mariam for stressing on this, but also thanks to everybody who has decided to take this time to spend it here. Tunasema asante sana. Because at times you could have come to such a talk and find probably half of the whole full. You could have said like, wananipotezea muda, but we say that tumeonyesha tunakuhitaji na tunahitaji this talk, and we have put everything aside to do this. Of course, our university is in the forefront of training, research, and many other opportunities that we have heard. And we believe such collaboration will not only strengthen our university, but will strengthen our communities. Because end of the day, whoever is here is part of the community. Today's discussions have illuminated the vast potential that exists within this to be partnerships, to be memorandum of understandings, to be side exchanges, and to be many other forms of collaboration. We believe that they will not only be fruititious here, but will be fruititious within this world in which we live. And definitely, as you saw my passion on the Agenda 2030, I believe that with your presence there and your talk today will definitely make this journey be better and be more fulfilling, not only about ticking of the boxes of the targets, but rather will be out of many programs that will be sustainable to be implemented in Tanzania. We have heard a lot about a lot of potential of the joint relationships, but again, I believe that we, majority of here, who are students who are pursuing their different programs, will take this seriously. Na tunasema those who are about 3,000, 30,000, you said like Tanzanians who are there, 300, we believe the number will triple, will quadruple, because end of the day, the more of us who gets exposure there will not mean that it's a small call, but rather will mean that we have really opened up the better ways of doing this relationship. As we wind up our meeting, let us carry forward the spirit of cooperation and innovation that will be characterized with today's discussions. Together, let us build on the bridges that will lead to shared knowledge, mutual growth, and healthier future for all. Thank you all for your attention and participation once again, and I look forward to seeing the fruititiousness of our discussion today. Ukisafiri, utasafiri salama na utaenda na memory yetu. That token that was given to you will also be something to remind of us. If there's anything that you have not ticked that it is done, that will remind you. Tunasema asante sana na asanteni nyote.
Thank you, Madam President, Ms. Masha Makatayambi, for those words of appreciation. Now we have come almost to the end of this program. I have just a few announcements. One of them I'd like to inform and welcome our alumni and everybody who is around here that this year we'll have a fun run on the 23rd of November. Please diarize that one. So each and every one of us will attend 23rd of November. And I will also ask our ambassador, the ambassador, after we have finished here, please don't be in a hurry to go because some people want to just have some few selfie with you outside, if you don't mind so much. I've been requested, so I have to say. All right, so I would like to welcome the ambassador and the vice chancellor and the deputy vice chancellor to come and sit here together with the Madam President. Tafadhali karibuni. Yes. That will be the first picture. And then I would like to welcome now the international and internationalization and convocation unit. Please, together with the head, to come in the front for the second picture. The unit, the member of the unit, tafadhali, tufanye upesi kidogo. Dr. Mariam, you can sit at this, just behind the, yes, there. Are you done? I will wait for others. Another picture is going to be the student represented, the representative of, the leadership of the students who are here will the Muhas leadership, the president, the vice president, if there's any minister or anyone who is in the cabinet. Yes. Hii ilikuwa inatakiwa iwe pia picha ya mwisho, lakini naomba kutoa picha ya upendeleo kwa wale ambao the alumni who are not here from Muhas. If you are here, please, you can come. There who are not here. I know you have come so far. And I will ask another picture. Because the space is not big, but whoever is one more person is coming. Organizing committee, please, that's the last one. Organizing committee. Asanteni sana, hiyo ndo ilikuwa ya mwisho, maanake mwisho zimekuwa nyingi mno. Hiyo ya mwisho. Asante, naomba we can stand as our guest is leaving. Just thank you so much. And for those who asked for a bit of selfie, you can run as fast as possible outside so that you get your picture. Also, we will